Hold tight for the next few minutes as we dive into a debate that could reshape how Singapore protects its people from influenza. In today's update on 2230, we're breaking down a heated discussion from Parliament that may have real-life implications for you and your family. MP Ng Ling Ling recently raised critical questions about the current flu vaccination subsidy criteria under the Healthier SG program, a move that has already stirred conversations across the nation. On February 5th, during a lively parliamentary session, she pointed out that only Singaporeans deemed to be in higher risk groups currently receive a fully subsidized annual flu vaccine. According to existing guidelines, free vaccinations are automatically given to seniors over 65 and children between 6 months and 5 years old, while those aged 5 to 64 are eligible only if they suffer from specific medical conditions. In a striking moment, MP Ng Ling Ling highlighted the case of a resident aged between 40 and 64 with high cholesterol, someone who, despite having a condition that could put them at risk, is not eligible for the subsidy. Adding even more weight to her argument, she referenced the tragic passing of Barbie Hsu, whose death was linked to complications from influenza. This reference wasn't just a somber reminder of the flu's dangers. It underscored a growing concern that the current criteria might be too narrow and could leave many vulnerable Singaporeans unprotected. The Ministry of Health, represented by Dr. Janil Puthucheary, responded by noting that the subsidy criteria are regularly reviewed. He explained that the MOH focuses on those who would face a significant effect on their health outcomes if they contracted the disease, highlighting the different considerations required for vaccines that need to be administered annually as opposed to one-off immunizations. Yet, MP Ng Ling Ling's call for change goes further, as she suggested expanding the criteria to include individuals with conditions like respiratory chronic diseases that are in remission. This isn't just a dry policy debate. It's a discussion that could influence the well-being of thousands. Could revisiting these criteria mean that more Singaporeans, especially those with underlying health conditions, might soon have access to free flu vaccines? And what might this mean for overall public health in a rapidly changing world? As these questions swirl, we want to hear from you. Do you think the current subsidy criteria are sufficient, or should the government broaden its coverage? Drop your thoughts in the comments below. If you appreciate deep dives into the issues that affect your life, remember to hit that like button, share this video, and subscribe to help us reach our goal of 11,000 subscribers. Stay with us as we continue to unpack the policies shaping Singapore's future, only here on 2230.